So I'm going to stop there and allow some times for some question and that anybody has about any of those things. Yeah.
In the prior panel, there was some discussion about the importance of implementation. And I wonder if there was any, you mentioned that the program was designed specifically for Chicago, and I wonder if there were any adaptations that occurred prior to implementation of the program, and what your thoughts are about that.
Yeah, great question. So there, by and large, Baltimore was sort of the favored by the Chicago group, because Chicago's been working with a number of cities to try to replicate Chicago's program. And in many ways, Baltimore really went out of their way to really follow with fidelity the program model. However, there was one important difference. And rather than have a distinct staff who only did violence interruption and conflict mediation, as they did in Chicago. These are individuals who often would help mediate gangs disputes at a high level. Because Baltimore's gangs weren't really structured as these multi-generational, hierarchical entities, they didn't think that was going to be needed. Interestingly, the program's been going on, still going on to this day, and they're now reverting back to, they've already put in the violence interrupters because they saw through our evaluation how important the conflict mediations were. And now in some areas, in terms of trying to think about sustainability, this isn't a cheap program to sustain. They are going to innovate and see whether you can keep those violence levels down just with the violence interruption component to it. So they sort of have come full circle from not even having any violence interrupters to, in certain areas, having only violence interrupters. Yeah.
Thank you very much. I have a question about the data. The conflict risk factors, could there be more than one factor identified?
Oh yeah, yeah. Almost always there were many, so it wasn't pick one.
The answer would be.
Yeah, yeah. These things obviously go together. Gang members have guns and they have histories of violence. So for the vast majority of things that they were mediating, you had multiple risk factors in play.
I also appreciate what you were saying about ceasefire and adapting for your community, because I think that speaks to what some of the panelists were saying earlier in terms of taking research and the need to adapt for culture and for context. So I appreciate that comment.
Thanks. Yeah, I mean, in this case, they adapted in ways that they thought made sense, but then went back to, in essence, the same program model, although now again, they're going off script to see what effects can you get with just the interrupters. Yes?
I'm interested in the gender aspects of your study, and I guess we're all assuming that these are all males, but I know that girl gangs are increasing across the country, and I know that increased in Baltimore area also. So could you speak to that aspect?
Quite honestly, we did not break the data down by gender because so few of the victimizations or offenders were females. Without a doubt, there is a growing involvement of girls and young women in gangs, without a doubt. It's interesting, however, that they still don't show up that much, at least in the gun violence component to it. A lot of those incidents are stabbings and fistfights. Mark?
Daniel, thanks for that presentation and that analysis. I think you've done extraordinarily fine and very important work in this area, and it's exciting to see it. At the same time, you present a real dilemma for the use of evidence, which is that when there was an increase in gun violence, that's when states and legislators and policymakers wanted the solutions.
Right.
And John Lott was available with his flawed studies at the time that they were looking for solutions, and he and his colleagues got many states to pass laws that were based on flawed data. now that those states have passed those laws based on flawed data and driven by ideology to a very large degree, not driven really by evidence.
Well, I think they were trying to apply evidence. It was just not very good evidence.
Fueled by ideology, driven by
Okay.
evidence. These were passionate people who helped these states look at the evidence and use the evidence to pass these laws. So now it's years and years later that we come back with much better evidence that really questions the validity of that early evidence. And in a way, it's too late to be the first at the policymakers' doors
Yes.
with solutions that are based on better evidence. So in taking the time to get really good data and do really good research, we kind of lose an opportunity. And I suspect the same thing may happen in other settings. What are some of the things that we as researchers and policymakers like Rodrigo can do to protect against that?
Well, I think if you try to rely upon some of the principles that I was laying out initially, where you do definitely study the impact, look for similar comparisons with similar trajectories. So quite often, violence is going up in more than one place. And in not every case does the political process work in the same way to generate the same set of policies. So I think that the more you can, again, not fool yourself that more data is going to solve your problem, but just get the best data for the best comparisons. I think that's really the best you can do from a scientific perspective. But maybe you're asking a different question, so.
I think there are a range of things we can do. One is, what can we do from the scientist's perspective? But I'd be interested in comments from other people too. It seems to me that most policymakers and policymakers who work at state levels or federal levels are not so programmed or well versed in the fine points of epidemiological studies. So it seems to me that part of our charge and part of our task is how to teach and prepare people who are policymakers to understand and use evidence. That's an important part of the task ahead.
Yeah, so right after Lott published his initial findings, I actually published some articles in American Journal of Public Health along with Jens Ludwig, in essence as a warning. We didn't have all the fine analysis that subsequently came from a lot of work from John Donahue and his colleagues. But there were a lot of warning signs that sort of suggested that this just didn't line up with sort of reality of what we know about gun violence. And even put all the stats aside, say you knew nothing about those issues, but you actually understood what gun violence looks like, okay? And you're giving permits to people to carry concealed weapons. If you looked at the data for who were actually getting those permits, they were generally middle-aged, married men in suburban and rural areas, okay? If you look at trajectories over time in state levels of homicide, robbery, aggravated assault, for example, that group of individuals, whether you're talking about as victims or offenders, is not driving those trends. So to come out with this evidence that by allowing these set of individuals to carry their guns and feel safe or whatever feelings they got from doing that, you know, it didn't sort of line up with how could that generate this evidence? You know what I mean? So when I was trying to talk to the media about this, and they didn't want to hear about trajectories and, you know, serial correlation or stuff that I find really interesting, you know, I just tried to break it down to that sort of elemental fact. You know, you have an intervention that doesn't sort of line up with the outcome so much. And sometimes it's just getting to that. And I think there's a real misunderstanding just about the causes and nature of violence. You know, if you listen to the discussion on gun policy, you have one set of individuals that are talking about this problem that is exclusively driven by career criminals, predators who are highly motivated to carry out their acts and will do so regardless of any sort of intervention. Okay. Yes, there's some component of gun violence that looks like, but there's a whole lot of gun violence that doesn't look like that at all. Involves different kind of actors and different kind of context. So part of it is just sort of getting down to that. What is it that we're looking at here and studying? And that really should help drive both our investigations of evidence as well as how we understand what to do about it.
One thing that we've done in other areas, for example, the Journal of American Medical Association has standards for cost studies that can be published in their journal, also standards for meta-analyses that can be published in their journals. Could we develop a set of standards which would have some of the elements you alluded to in your talk for this kind of policy research on panel designs or something like that?
I think it's a great suggestion, Jim. I think that I don't know that meta-analyses will necessarily be the answer because, again, you sort of, at least if you're going to study state policy, you have sort of a finite number of interventions, right, that you can study and potentially examine. And whereas you do an individual or school-based analysis, you can do a whole bunch of studies over a whole bunch of contexts and pool the analysis and so on. But I think what you could do is sort of line up some of the key things that should be part of any serious investigation of a policy. And that is, how similar are the comparisons? How well do they track their trajectories pre-intervention, or they're otherwise able to model to account for those trajectories? So I think you could come up with a set of basic criteria for seriously considering evidence for policy interventions.
But then you have to sell the politicians on accepting those criteria. And so you've got to have, they need to have a place to go that people, either a academic group or somewhere that they trust, that they will ensure that those, whatever they're going to recommend depends on those criteria, because the politicians aren't going to go through those criteria.
Right. So I'm getting the signs that time's up, so I think we're going to transition here. I appreciate the questions, and maybe we can chat over lunch or other opportunities. But I appreciate the feedback.